Well, I agree with you going back to NGS. So for everybody listening, in 2019, we switched to NextGen sequencing for all of our sampling of explant specimens. So we have the largest experience with NGS in the world on that. And that's what we published. So, and when we have a problem with a refractory urinary tract infection, or if there's a question, I don't default to what Dr. McCann knows is very antiquated, which is a swab culture. We will always either do NGS preferentially, or we'll send both, because with NGS, you don't get a antibiotic sensitivity pattern, which in some cases is necessary, obviously for treatment. And you'll send a regular culture just to try to get some information regarding that. In terms of genetic mutations that contribute to hypercoagulability, certainly having an MTHFR, which about 40% of the population does, contributes to hypercoagulability. In fact, I would not do microsurgery on anybody who has I stopped doing that in 2000, maybe 17, 18. Anybody who had MTHFR mutations, I would not offer microsurgery to because of the increased risk of microvascular complication. So I agree with you. Like, the devil's in the details always. And I hold uh, a really, really strong conviction that if you understand your genetics better, it becomes much easier for both you and your provider, obviously, to take care of you. But then you can navigate a pretty complex world a bit better if you understand those things. So, man, it's been a great chat with you today. And I want to make sure everybody can find Dr. McCann. So I'm going to let her tell you her social media handles, her platforms that you can follow her on to learn more and maybe visit her.
Thank you, Dr. Rob. I am in Southern California. I have a brick and mortar practice. You can find me at thespringcenter.com. You can also find me on social at Dr. Kelly McCann. So I look forward to seeing what happens with all of this. I think that mast cell activation and breast implant illness, there's such an overlap and such a need to understand this. So thank you, Dr. Rob, for having me. And it was a pleasure speaking with you.
Thanks for hopping on.